Welcome back. Today, I want to talk a little bit about some questions you may want to consider asking your neurosurgeon as you prepare for surgery. Now, to give you some context, I talk a lot about this on my channel, but if you're new here, I had brain surgery back in November of 2023. So I have experience in this topic. Obviously, I'm not a medical person, but I am a patient who has experienced this. So I'm just giving some of my, the things that I wish I would have known going into this process so that it can hopefully help someone else out. Now, I have these questions on my computer, so if you see me looking down, that's why. One of the first questions you should ask, this might seem obvious, but it wasn't for me at the beginning. You want to ask what type of brain surgery you're going to have, and that's going to depend on the type of tumor you have and the location in your head where the tumor is. Now, I'm sure many people, when you hear brain surgery, you think craniotomy, which is where they take a portion of your skull and they remove it to access your brain. I think they call it creating a window to the brain. And typically with that, they use a saw, some type of obviously a medical saw, and a drill, and they get the skull off, access your brain like that. That was my extent of knowledge when it came to brain surgery, but that's not what I had. I had what's called an endonasal approach to brain surgery, which means they went through my nose because my tumor was in the front of my head in my pituitary gland. So there was no real reason for them to take a piece of skull off, because that's what I thought they were going to do. I thought they were going to take a piece of my forehead off and operate like right here. And I knew for some surgeries, they actually wake you up during it. So now I'm picturing being woken up during this surgery, the doctors right here, and them just, so glad I didn't have that. So you want to ask what type of surgery you're going to have. The next question you should consider is, what type of medication am I going to have to be leading up to the surgery, while I'm in, after surgery, during recovery, and then any potential long-term medications. Now, for me, I was on a steroid for 2 weeks, I want to say. It wasn't that long, thankfully. And that's because when they did my surgery, they took the tumor out, but they also took a third of the gland out. And when they take a piece of your gland out, it affects other parts of your body. So your body has to go through a sort of a reset. And during that reset period, I was on hydrocortisone to supplement the cortisol that my pituitary gland wasn't producing, which was having an effect on my kidneys. So you want to ask what type of medication you're going to be on. And I know leading up to the surgery, I couldn't take, it's either acetaminophen or ibuprofen. I can't remember which one. But in the few weeks leading up to surgery, I couldn't take whichever of the two that was. I'll try to, put it somewhere. But I couldn't take that because it's a blood thinner. And when you're preparing for surgery, you don't want to do any kind of blood thinners. So medications are a big thing you need to talk to your surgeon about. The next thing is the recovery process, both in the hospital and at home. Now, I was in the ICU for 3 days. I didn't really need to be in the ICU that long, but when they were ready to transfer me to another room, they just didn't have a room available, so I was in ICU. But you want to ask what you can anticipate during that period. I will say for me, and this is not to scare anybody or anything like that, but I do believe in transparency, especially when it's something medical. The hospital stay was miserable. I'm pretty sure I talked about this in a previous video. It was miserable. And that's not because of the hospital staff, the doctors, the nurses, nothing like that. It was just painful. It was uncomfortable, it was painful, it was all of the above. So ask them about that, and then what to anticipate in terms of recovery, moving forward. And that is both short-term recovery and long-term recovery. And also, this is what I wish I would have asked, and I did not even think about it. You obviously are going to be focusing initially on the physical aspect of recovery, but ask about the mental aspect of it. The mental aspect of recovery hit me like a ton of bricks. Months later, so many months later, I thought that I was good. I had healed physically. I was like, I didn't survive brain surgery. And then all the emotions hit me and I struggled. So, physical recovery, mental recovery, definitely touch on both of those. Anticipated pain levels. This is important because I think a lot of times when you have a surgery and you ask your doctor, like, what kind of pain am I going to be in? I don't think they always fully, I don't, it's not that I think they're being dishonest. I'm not saying that at all. But I think sometimes it might be in the patient's best interest to not know how bad it's going to be, because a lot of people probably wouldn't go through with a surgery, especially a much needed surgery, because they're scared of the pain. And I understand that. So anticipate whatever your doctor says in terms of pain levels, multiply that by at least two, at least two, but maybe even more, because I think they kind of underestimated, so to speak, the pain that I was going to be in, and it hurt. It was painful for quite a while. And there were moments where it wasn't necessarily painful, but it was very odd sensations. So for instance, with this surgery, after they, did everything and they patched me up, they put dissolvable packing in my nasal cavity. And you can't feel it. It's not like someone putting Kleenex up your nose, but it creates pressure changes in your head that you can feel. And those pressure changes, they don't hurt per se, but they're very odd. Like if I were to lay down flat, I would feel some, I want to call it movement. We'll just call it movement. I would feel some movement in my head, and I'm just like, what is that? If I would lay to the side or this side. And then when I was in the process of removing the packing with this nasal irrigation kit, you can feel the water traveling through the packing as it's trying to come down the other side. And I did a video all about that, on my channel in more detail. But, those very odd sensations kind of ask about, and then, just the overall anticipated pain level. And this kind of goes into the question I mentioned before about medication. You want to ask what type of pain medication you're going to be on. I think that's very important. I was on a very low dose of Oxy, 5 milligrams to be exact. It felt like, and I hope you all aren't hearing that, the wind is crazy today. And anyway, but what was I saying? The Oxy. It felt like it was just taking the edge off of the pain. Like the pain never went away fully. It was just, is it like super painful, or is it just painful, or is it like it was like different levels of pain, but the pain was always constant. So you want to ask about your pain medication, especially if you have any issues with pain medication in the past of, being addicted to it or anything like that. Definitely want to talk to your doctor about that. Another thing is surgery prep and different scans you might have to do. So you most likely will have to do a very intensive MRI scan and a CT scan. Now, if you're claustrophobic, the MRI scan is probably going to be an issue for you. I'm not even gonna lie, because it's very loud, it's a very small space, and it's very long. It's 45 minutes on the low end, like up to an hour, maybe even a little bit more on the higher end. And yeah, I'm not claustrophobic, but it sucks. And it sucks more after surgery, because when I was talking before about those pressure changes in your head, imagine you're laying flat and you feel that pressure change and almost feel like the room is spinning, and you have to sit perfectly still in this MRI machine for 45 minutes. It sucked. So talk about pre-op scans and different appointments you have to do, blood work. You probably had to meet with the anesthesia team, talk about how, your body's gonna react to anesthesia, especially if this is your first time being under anesthesia. This was my first time. I didn't have any issues with it, but it is kind of strange waking up from it. But I did a lot of research going into this surgery about it, so I kind of knew what to expect. And I didn't have any kind of adverse reactions, or, I wasn't super emotional when I woke up. I wasn't disoriented. I knew exactly where I was. I knew why I was there. I recognized, my family immediately. But it's like your brain is just moving slow, but luckily I was okay with anesthesia. The other thing is you want to start this conversation probably with your job, but obviously you want to talk to your doctor about it too, is paperwork. So you're going to have to get, FMLA paperwork from your job so that they can't fire you as you're recovering. And then talk to your job about short-term disability, long-term disability, whatever you have to get on or whatever you have available to you. And then you want to talk to your surgeon about it, because either your surgeon or maybe his office manager is going to be filling out that paperwork so that you can give it back to your job. So you just want to have all of that in order. Also, kind of in terms of paperwork, is I would highly recommend, this is something that I told myself to do, but I forgot to do it. Talk to your insurance company about the estimated cost for you out of pocket. I kept telling myself to do this and I forgot. And when I woke up from surgery, it was one of the first things I thought about. I said, oh my God, I don't know if I can pay for this. So just call them and try to get a ballpark range. Now, luckily for me, I'll be very transparent about how much it costs. Luckily, my insurance is very good and it showed up exactly as it was supposed to show up. This is not me trying to big up insurance, and I'm not getting into that whole topic, but it worked as it's supposed to work. I pay for, I get health insurance through my job. I contribute every month. It should show up for me when I need it. So when I got that bill, I got a notification for my MyChart. I don't know if you all use MyChart, but got a notification saying, you have a bill available. And I was just like, how much is this gonna cost? And I opened it, it was $430 for brain surgery at one of the most prestigious hospitals in the country and arguably in the world, at Johns Hopkins Hospital in Baltimore. And I was in the ICU for 3 days. $400. I was like, are they missing a zero? I couldn't, let me just pay this before they realize their mistake, but it wasn't a mistake. So grateful for how affordable this was for me. And again, I'm very grateful for having, good insurance. So talk to your insurance company prior to, obviously, you're going to need to get approval, but talk to them about how much you can anticipate paying out of pocket and what your co-pays are, because again, you're going to have to do multiple pre-op visits leading up to surgery. This may seem obvious, but I think some people may have a not miscommunication. They might think that this is not how it ends up being, but ask your doctor what their next available surgery dates are, because I think a lot of people go into having surgery thinking it's going to be a fairly quick process. Like, oh, I meet with my doctor and I'm going to have surgery in a couple weeks or next month. It's probably not going to be that fast. I got diagnosed with this tumor in March of 2023. I had surgery in November. So it was like 9 months, something like that, later that I had surgery. So, and I didn't meet with my neurosurgeon until August. So depending on who your surgeon is, they might be backed up for months. So just kind of anticipate that. And if that's the case, use that time as productively as possible. Mentally prepare yourself for what you're going to go through. And then the last question, this is a very off the wall question, and I'm a little off the wall, so it's goes in alignment with who I am as a person. But as I was finishing up this conversation or this first appointment with my neurosurgeon, he was like, okay, do you have any other questions? And I was like, yeah, but it's a little strange. He was like, oh, I've been doing this a long time. I've heard it all. What is it? I was like, after this surgery, is there any way you can salvage a piece of my skull and give it back to me? And he was like, excuse me? He was like, why would you want that? And I was like, well, it's not every day somebody has brain surgery, and I had to consider all of these risks, and I had to risk my life to have this surgery. If I survive it, I want a souvenir. And he was like, and what are you gonna do with it? And I was like, well, I'm gonna get a little box, just a little kind of artifact type box, and put it in there and have it labeled or have it engraved with my name, 2023. And I was just gonna put it up on my bookshelf and then, pass it on down generations, and like 4 or 5 generations down the line, they'd be like, look, this is Adrienne 2023. Here's her skull. Like it's a dinosaur bone or something. I just really wanted it. And he was like, that's interesting, but no, I'm sorry, we can't give you your skull. And I was like, why? It's not like, I didn't think it was violating any kind of HIPAA laws because it's mine. Like, I made it, But he said that, for surgeries, whatever they take out of you is either, I believe it's either considered medical waste or they send it to a pathology lab, especially with tumors. So he said that they would send it off to a lab, test the tumor, and they would actually keep samples of it for potential future, not use, but like if I had a tumor grow again, they might test that and then compare it to the other samples from this surgery. And so they keep samples. But also he said with my type of surgery, there wasn't going to be any bone to salvage because they drilled through the bones on the inside of my skull and they didn't saw through it like if you were to have a craniotomy. So he said there's basically bone dust. So there's nothing to really give you. And I was like, damn. When I tell you I wanted that, I would have proudly had it like up on this bookshelf, but that's probably not something that you want to ask. And if you do, anticipate your surgeon saying, no, you can't have a piece of your bone. But anyway, those were the questions that I had for my surgeon. I'm sure there's some that I missed or some that you all may have thought of that I didn't, but I think this is a good start if you're going to have this surgery. So if you had this surgery and you had other questions, let me know down in the comments. Or if you come up with other questions and want to know if it's, I don't know, a good idea or my thoughts on it, definitely leave that below. So I hope you all enjoyed my questions for my neurosurgeon for brain surgery.